Now for the third challenge, the team from St. Vincent's, Dr. Alan Snell.
Thanks, Matt. And before I get to our challenge about the blood product tracking, I'd like to say on behalf of Indiana HIMSS, which I represent here today also, how thrilled we are to have all of you here. And I can really feel the creative energy in the room. And in Andy's earlier remarks about Todd Park being here, I know many of you were at the Midwest HIMSS event that we hosted at the JW Marriott last November. And if you were there when Todd Park and about 400 attendees gave the closing keynote address, if you could watch him running back and forth across the stage and all that creative energy that he had. And what he said, and one of the takeaways that he gave us that day, was that Indianapolis and the state of Indiana has the opportunity to become the Silicon Valley for health IT. Do you remember that, those of you who were there? So that's really kind of what started the thinking process, and Al Givens was in the audience that day, and he was jumping up and down, I think. And he contacted me right afterward and said, Alan, we have to do something here. We have too much opportunity to let this slip. And so that's really kind of what things started. And of course, then Matt and Andy and others got involved in this whole project to bring us to today. So we're very happy to see you all here. This is exciting. So for St. Vincent Health, I am the CMIO at St. Vincent Health, and actually I have a team of experts here. I don't claim to be the expert in this particular area, but this is a big area and a big challenge for us, not only in the Indianapolis or St. Vincent area, but really across the state, across the nation. This is an international problem, and we'll explain to you why that is today. And my two experts that I have here, whoa, that didn't come out very well, did it? Yeah. The background slide, I don't know what happened there. Anyway, I'll go ahead and introduce. First of all, with me is Dr. Tim Hannon. Tim, would you come on up? Dr. Tim Hannon is the longtime anesthesiologist at St. Vincent Health. And he, before becoming an anesthesiologist, he was a flight surgeon in the Air Force. And he has been... Navy, excuse me. Yeah, I can't mess that up, right? In the Navy, right? Fighting with us in the Navy, and he is really our local expert at St. Vincent in Indianapolis on blood product utilization and safety, and has distinguished himself actually nationally in that regard. And so he then, as an entrepreneur, he created his own company, Strategic Healthcare Company, and has across the country helped other hospital systems manage their blood products and the patient safety around transfusion. So he's made quite a name for himself there. So he's here to help us understand the whole issue of blood product transfusion safety and the problems that we face in that. And then also Troy Reef. Troy is a nurse, 16 years at St. Vincent. He serves now, since 2002, as the Chief Operating Officer for our Seton Specialty Hospitals. These are called LTAC, Long-Term Acute Care Hospitals. We have two of them, one here in Indianapolis and one in Lafayette. And he's the Chief Operating Officer for that. Also has a lot to do with the patient safety and all the core measures and quality that we are required to track. And the other thing about Troy is he's my innovator at St. Vincent. I call upon him frequently for new projects, and these Seton Specialty Hospitals are great incubator places to try and pilot our new technologies. And so Troy is my go-to guy for that. Troy has distinguished himself nationally as a leader in the RFID space for tracking mechanisms. And at this year's HIMSS, if any of you were there and you were able to see the new Intelligent Hospital display that was at HIMSS in Vegas this year, Troy actually co-developed and helped implement that and he's involved in several national organizations around this space. So I'll have full bios in our room 162 when you come to visit with us. So forget that last slide, they just had their names on it. So we'll move on then. So here's the problem. Here's the problem that we're trying to solve. And blood product administration and transfusion safety, we're still in the dark ages in many aspects. Now, this report comes out every few years, so the latest information we have is 2009. And we don't have statewide information on this, but this gives you an example of the U.S. and District of Columbia. So 17 million units of blood were collected, 23 million units of blood components, because blood is collected and then it's spun and broken down into multiple components like platelets and other things that come out of that. 14 million units were transfused. Now, here's an interesting fact about blood in our country and blood products. We have a surplus. The problem is not a shortage, even though you'll hear calls for come quickly when there's disasters, come quickly and donate. We actually have surplus of blood in our country and in our state. It's a maldistribution issue. And it's the expiration and the waste that, and you can see there 16%. So that's a huge cost to us in the healthcare industry, and particularly hospitals. And as we move toward accountable care and some of these new payment models, we're going to be stuck with that cost. We cannot pass that on to the patient or to their insurer. So those are some statistics on from 2009, the latest year we have that. And you can see, again, average cost of blood for a single unit of blood is $223, and 16% of all units go to waste. And in some cases, that's much heavier, much bigger number than that. So I'm going to turn it over to Dr. Hannon now to tell you more about the process.